I've had an exciting career as a heart surgeon. Imagine stopping the heart, fixing it, and watching it restart beat by beat by beat. When I retired, I was looking for some way to still stay connected with my profession. A number of my colleagues were volunteering at a part-time clinic at the House of Charity. Unknowingly, I would begin my journey there. While there are many stories from the House of Charity, one in particular would move me forward. This young lady had developed an increasing cough while working on a trial basis for a telemarketing company. She was in the transition period between unemployment and full employment with total benefits. But if she took any more time off, she would lose her job. I thought she needed lab work and an x-ray, things that I could not provide. I advised her to go to the emergency room, but she was reluctant because of cost. As I later learned, my treatment failed. Her cost increased, she lost her job, and she was ultimately hospitalized for a short time. That made me realize that we needed some way to provide total care for people. Trying to understand how a safety net fills a healthcare gap, I took a course at the Kennedy School of Government. One of the professors there talked about an innovative program called Project Access in Asheville, North Carolina. The physicians in the medical society there had aggregated their charity care together, and around this core, they had built a total program that included specialty care and hospital care. Intriguingly, a surgeon who had just replicated the program to Wichita, I had worked with that surgeon. I thought naturally, with a surgeon's pride, if he can do it, I can do it. My wife is English, and in England, when you travel in a train station, you see all these signs that say, "Mind the gap." No one wants to fall into the gap between a train and the platform, and no one also wants to fall into any healthcare gap. So while I was in the operating room, my wife Rosemary had served on a number of nonprofit boards, and she had become adept at community networking. So I called her and I said, "We can do this." I said, "I have the development plan from Wichita. They did it in less than 1 year. Just tell me who I need to see." Well, one of the first people I went to was the head of a healthcare network. And as I was going through pages of slides with her, she said to me, "Sam, this is December. I have this money I need to spend by the end of the year." And I thought, why is she bothering me with her problem? You know? So I went on with the slides. And again, she said something about having to spend this money in a few weeks. And I thought, why is she interrupting me again? And she finally had to stop me. And she said, "Sam, do you want the money or don't you?" I realized then that I had to listen, that we really needed to be engaged with the audience. We had our initial money, and we also had a network to monitor people. So while we were organizing Project Access, I had a call from a newspaper reporter who wanted an interview concerning what we were doing. As a surgeon, I always wanted to have a successful program first and then go to the press. First success, then press had been the rule. One of my colleagues said to me, "Without that interview, you're going to fail." And I valued his advice. I summoned up courage to go and do that particular interview, to tell the community what we wanted to do. I would shortly learn whether that was good advice. Well, we continued organizing. Hundreds of physicians volunteered to give care away free through Project Access. Providence Sacred Heart donated money so we could have staff, and the hospitals agreed to treat free whoever we treated free. But we were missing one element, and that was short-term medication. Other project accesses had used funds from cities and counties for that, and I thought it was worth a try. The first one I went to said they were impressed with my presentation, and importantly, they were also impressed with the fact that I had positive press before I had come to them. They said that they would contribute. The second one said they really didn't have any funding, but they would actually help me recruit from the other ones I wanted to see. I thought that was interesting. All of the rest of the 8 I went to said yes, that they would contribute, and they helped me circle back so that we had everybody contributing to this. The dedication to having everybody contribute in some small way made this a universal program. Well, now, Project Access was up and working well, but the community still had an issue, and that issue was long-term pharmaceutical medications. Now, how do you get long-term medicines for people? We looked for various models and we couldn't find any. The best model to be efficient should be a state model. On the other hand, to really deliver for a particular individual, it needed to be somehow integrated into the community. When we took a model forward, we were really surprised. There was suddenly a collision of models out there. The pharmaceutical manufacturers, had launched a new statewide, a new national program. Governor Gregoire had launched a state program that was a discount program, and we wanted a community-based program. I can tell you that there were some interesting discussions, but I'll say that everybody there wanted patients to be able to really get the medicines. Senator Brown drafted pharma-backed and a bipartisan legislative coalition passed a bill creating the Prescription Drug Assistance Foundation. This is a nonprofit organization. The board of the foundation is appointed by the governor, and the foundation receives no money from the state. Can you imagine in the modern day the synergism of having national companies, bipartisan state government, and individuals in 1 year working together to improve health care in the state? Well, we had a foundation, but how do you fund it? I was really at a loss. I called the governor's office to give my thanks for her enthusiasm and for signing the bill that made it into law. And I wondered, was there some way to celebrate, to have the governor there? I was thinking publicity, press, something like that. They called me back and they said, "How about the mansion?" Well, this time I listened. The governor's mansion is an exquisite location, and the Prescription Drug Assistance Foundation would pay for a fundraiser in the mansion. We were very fortunate. We had broad financial support from Providence Sacred Heart, other hospitals, pharmaceutical companies, individuals, and other corporations. Where are we now? Well, Project Access, the 600 plus physicians that are part of Project Access and the hospitals have donated more than $29 million worth of free health care. The Prescription Drug Assistance Foundation has only been up and running 3 years, but in 2011, the Prescription Drug Assistance Foundation helped people in Spokane access $2.5 million worth of free medication. That's average wholesale price. And the people of the state of Washington, $6.5 million. That's a 29-to-1 return on investment. The website is MTG Meds. You might remember MTG. For us, it means meet the gap rather than mind the gap. One of the people referred to the Prescription Drug Assistance Foundation recently came from the House of Charity. We helped that man obtain 2 types of insulin, and now with his diabetes under control, he is out looking for work. For me, it's been a 10-year journey. The circle is complete. It's been 1 state program and 1 local program. So that really is the unexpected journey. But you know, my unexpected journey is that in helping others, I've been changed. I started as a surgeon, an operating room focused on 1 person. Now I try to be attentive and listen to the community. I was safe. Who wants a risky surgeon? Now I'm willing to take the risk of failing. I was inflexible. Some say I'm still a little inflexible. But I am collaborative, and I try to zealously help others. And above all, I try to celebrate my partners. I want to thank my wife and all my friends for making me a better person. And I am still amazed at all the people that share my particular passion. Do you? Thank you.